Hey, it's Dr. Thomas Spain again at WellBe in Huntsville. Several people have asked me about the projections coming from this website, talking about COVID-19 projections for the United States and for different states. You may have seen this recently on social media or maybe even on the news. So I thought I would take a few minutes and walk you through the different parts of this website and really talk for a few minutes about what is this website showing, what does it mean, what does it not mean. So I'm going to do this in two videos. The first video is going to focus on really how these models, how should you look at these models, and we'll look at the hospital resource use part of the model. The second video is going to focus on their projections around mortality, and then we're going to talk some about what we can do with this information. So with that, let's hop into looking at the website. So this website was put up by the Institute for Health Metrics and Evaluation, which is actually based at the University of Washington in Seattle. This is a healthcare research group that does a lot of modeling and statistics and research around healthcare related issues globally, not just this pandemic. And I think that's important to know that this is coming from an organization with well-trained scientists who do rigorous research and produce reputable information. So like any statistical model, this is a model, and it doesn't mean that reality is going to match the model, but the model is useful for predicting what we can expect the most likely outcomes to be. And we're going to talk a little bit about that as we get into this. So here's the website. You may have gone out and looked at it, or you may have just seen pictures from it. And I'm going to drill in on Alabama specifically. So a few things, anytime you look at a model, there are going to be assumptions that they take, and they've talked about some of the assumptions here. One of those assumptions is that these assume that full social distancing will be in place through the month of April into May 2020. I think that's important because as we're looking at these numbers, know that these were based on numbers as of April 1st, so 2 days ago, and these were based on the assumption that we would continue to do full social distancing, that people would really do a good job staying the course at social distancing for the whole month. That means if we were to not do as good a job of social distancing during the month of April, that this model wouldn't be accurate. In fact, it would expect that the outcomes could actually be worse, the timeline could be different. So I think that's important to note. And you can see that state by state, they've given kind of a timeline of social distancing when the schools were closed and non-essential services were closed. Just this afternoon, right before I got on to do this, it was announced that Alabama is implementing a stay-at-home order tomorrow at 5 p.m. So that'll be coming soon to this. So let's just dig in and look at this for a few minutes, and hopefully this will help you kind of understand what you're looking at. The first part of this model is looking at hospital resource use. What does that mean? Specifically, it's looking at hospital beds, ICU beds, and ventilators in the state of Alabama. How many do we have, and how many would we expect based on this model we could need? Why hospital resource use? Well, actually, a lot of the public health interventions with social distancing are looking at how do we protect our healthcare system from being massively overrun with demand, stressed to the point where it's not able to take care of the various things that come up in the course of a typical week or month in the community. Because as you can imagine, during this pandemic, things like heart attacks and strokes and cancer and car accidents and anaphylaxis and pneumonia and those sorts of things, diabetic emergencies, none of those things have stopped. Those things keep the hospital busy all the time. But now we have this pandemic of COVID-19 on top of it that really creates additional strain on the healthcare system. And if it creates too much strain on the healthcare system's not able to take care of the people who are sick, who need those resources, and mortality goes up because the people with COVID-19 don't get the care that they could get if there were sufficient resources, but also the people with heart attacks and strokes and cancer aren't able to get the care that they need. And so some of them die from preventable causes. So we want to avoid that, obviously, if we can. And that's what a lot of this is about. So that's why this is focused on hospital resource use. And their model, as you can see here, is predicting, based on the data from 2 days ago, that we would peak in our resource use in the state of Alabama around April 17th, which is 2 weeks from now. And so let me orient you to this chart, and I'm going to choose one that just looks at a specific resource first. So this is looking at hospital beds. All right, so this is This is a chart here on the vertical axis, the y-axis. It's looking at number of hospital beds, 5,000, 10,000, 15,000, et cetera, going up, okay? Here along the x-axis, the bottom axis, it's looking at time. Here's the 1st of April, which was 2 days ago. Here's May 1st, and you can see that most of the action in this model in terms of resource use is happening, predicted to happen during the month of April. Then what we have here are the dotted line here is the projection out of the model of beds needed over time, of hospital beds needed over time. This shaded lavender area that you see here is a confidence interval. You can think of this as like the range of possibilities out of this model. If the dotted line was the output, you think of that like the most likely scenario based on the statistical model. There are a number of other scenarios that the statistical model said are possible, and those curves would fit within the shaded area. So this bottom of the curve right here that I'm tracing with the cursor, you could think of almost like our best case scenario in this model. If it has a very low peak and it looks like it comes a little earlier and then goes down, the top of this purple shaded would be from this model, that would be like the worst case scenario that's predicted possible if we continue to do social distancing out of this model. And then the dotted line here, sort of in the middle, is reflecting really kind of that most likely output of the model. So when you look at something like this, know that actually anywhere in this range of purple over time is a possibility based on the projections from the data that they put into the model. It's also important to then know what this flat line is across here that I'm tracing with the cursor. This flat line is actually the number of beds on record in the state of Alabama in our hospitals, 5,743. And that's based on data that's available for each hospital. And the reality is that that number can fluctuate up a little bit in an emergency situation like this by creating additional new bed space in the hospitals, in the hallways, in the ambulance bays, other places like that. But it's very difficult to double or triple this number quickly. You certainly can't do it overnight. And that's what we've been seeing in New York City, for instance, where they've been creating temporary hospitals in Central Park and in the convention center and the hospital ships and such. That's about creating new hospital bed capacity quickly overnight because of a situation like we're about to see could happen here in Alabama. All right, so that's the general layout of a projection like this. And I want to stop, before we go through and look at the specific numbers, I want to liken this to something that I think a lot of us are really familiar with in North Alabama particularly, and that's meteorologic forecasts. So when they forecast the weather, when the meteorologists forecast the weather, say a tornado path or a hurricane path, they actually do a model exactly like this, looking at the possible path for the hurricane, the possible path for a rotating storm. And you're used to, like with the tornadoes, when we're watching it live, if there's a tornado warning, there's a fan that you see out on the screen that's predicting when the storm is going to get to certain places, and it's showing the possible paths that it might take. And it becomes less certain the further in the future it goes. The fan gets wider. Or the cone of uncertainty with a hurricane, we're used to seeing, when it's several days out, there's this range of possible paths it might take. And so there's a few hundred miles of coastline perhaps where the eye might hit. And as it gets closer, it gets more certain. The data gets more certain. That cone of uncertainty, or that fan on the tornadoes, is exactly the same thing here. This is a model just like they've created based on data with science and assumptions. And there's uncertainty in it. And so that's what this is representing. Okay, so let's take a minute and let's look through this, and then we're going to move, in the next video, we're going to talk about the other graphs and kind of what do we do about it. So you'll see that here at the peak of predicted resource use, they're saying based on their model that they project we would need 27,498 hospital beds in the state of Alabama on that day, compared to the 5,743 that we have in the hospital. That's clearly a significant difference, and that amount of strain on our hospital system would be a crisis. But the model is saying that it's possible that that peak could be as high as almost 50,000 hospital beds needed in this worst case scenario in the model. And it's possible that best case scenario in the model down here, that we really only need about 5,100 beds, which is slightly below the number of beds that are available. And if everyone was distributed perfectly in the right cities in proportion near the hospitals and everyone could find a bed, there might be enough beds to go around. So you can already see that most of our projections for the month of April from this model would say that we will enter a situation sometime in the next couple of weeks where we have more demand for hospital beds in the state than we currently have in the state. And that creates a situation that we really would want to avoid, and it's going to create a lot of additional challenges for managing. So let's look over here then at ICU beds, the same sort of thing. What we're looking at is how many ICU beds do we have in the state? 474 on record. How many does this predict that we would need at the peak in about 2 weeks? And it predicts that we would need 4,537. That's almost 10 times as many as we have in the state. It says worst case scenario, we could need almost 20 times as many as we have in the state, 18 to 20 times as many as we have in the state, 8,200 ICU beds. Best case scenario here in this model, you'll see, is it says that we would need 934 beds, which is already twice what we have available in the state. So this model is saying that based on current data 2 days ago, their projections would say that any way you cut it, we are going to need more ICU beds this month than we have. And that creates a strain on the hospitals when they have to try to create additional ICU beds or capacity. And then this is looking at the same thing for ventilator use. Now you'll notice there's no line here because the number of ventilators in the state is not something that's easy to get from published data, from public data sources. And also, as you've seen in the news, ventilators can be moved around in emergency situations. And so this is saying that we might need over 3,000 ventilators in the middle of the month at the same time. And I would dare say, particularly given that we only have less than 1,000 ICU beds, you think about our availability of ventilators in Alabama, this is more than we would likely have. So this is creating a situation that certainly the Department of Health and the hospitals and others have been planning for weeks. But this is why there's been so much emphasis on social distancing, because if you look at the range of possibilities here, there's a good chance this month that however this goes down, there's going to be circumstances where we have more demand on our healthcare resources, far more demand than we have supply. So that's an introduction to this website. In our next video, I'm going to look at the other graphs about mortality, and then we're going to talk about what we can do about it.